Hi, hello everyone, this is your nursing student Brian, and for today's video, we are going to perform the physical assessment of the thorax and lungs, okay? Without any further ado, let's start it. So, prior to the performance, we need to introduce ourselves and verify our client's identity. Okay? I'm going to ask my clients about his name to verify or confirm if he or she is my patient. Okay? Hi sir, good afternoon. I am your nursing student Brian. So you are Mark Petronius, sir. Am I correct? Yes, okay. So you are born on July 4, 2008?
Yes.
Okay. So you're from Borawin, sir. Am I correct?
Yes.
Okay, that's good. Sounds great, okay? Next is we need to perform hand hygiene. This is to prevent ourselves from the transmission of any bacteria or diseases, okay? After that is we need to provide clients privacy by closing the door, the window, and using curtains and the procedure to provide clients privacy. Next procedure is we need to observe the color of face, the lips, and the chest of my client. Okay? Sir, I'm going to touch you. Would it be okay?
Okay.
Alright. Let's see your face if it's symmetrical. Okay, it is symmetrical. No deviation at the left or right. Your lips, okay. Your chest. Alright. So, based on my inspection, the client has heavily colored skin tone without unusual or prominent discoloration. Okay? No signs of cyanosis that may be seen in the client who was cold or hypoxia or hypoxic. Next is we need to inspect the color and shape of the nails. Sir, can I see your nails? No, your nails. Alright. Alright. So, based on my inspection, the client has a pink toned nail bed. There's normally a 160-degree angle between the nail base and the skin, okay? There's no paleness or cyanotic nails that may indicate hypoxia. Next is we are going to inspect the configuration of the posterior thorax, which is the shoulder and the scapulae. Sir, I want you to turn back for me. No, the other one. Okay. Let's say your scapula. Okay. Your shoulder. Alright. So, based on my inspection, the scapula are symmetric and non-protruding. The shoulder and scapula are equal horizontal positions. Okay? The spinous processes upper straight and the thorax upper symmetric, with the ribs sloping downward at approximately 45-degree angle in relation to the spine. No signs of scoliosis or barrel chest. Okay? The spinal cord is straight, therefore no sign of scoliosis or barrel chest for the ribs. Next is we need to observe the use of accessory muscle and intercostal spaces. We need to watch the client breath and note for the use of muscle. Okay? Sir, I want you to breathe normally so that I can inspect or observe if there is any abnormalities while you are breathing. Okay? If you are using any accessory muscles. Alright. Based on my inspection, the client does not use accessory muscle such as the trapezius or the shoulder muscles to assist in breathing, okay? The diaphragm is the major muscle at work. This is evidenced by expansion of the lower chest during inspiration. No signs of tripod positioning. Next is we need to inspect the client's positioning. We need to note the client's posture and ability to support weight while breathing comfortably. Okay, sir, can you see your position? Alright. While you are breathing. Okay. So, based on my inspection, the client is sitting up and relaxed, breathing easily with arms at this side. Next is we need to palpate the posterior thorax of my client for tenderness, sensation, and surface muscles. Sir, I'm going to touch you. Is it okay?
Okay.
Alright. Just tell me if there is any pain. Is there pain? Did you feel pain?
No.
How about here? Did you feel pain?
No.
This one, is there any pain?
No.
Over here? Did you feel pain?
No.
How about here, sir? Did you feel pain?
No.
Over here?
No.
Over here? Is there any pain?
No.
This one? Over here, sir, is there any pain?
No.
Over here? Is there any pain?
No.
Alright. So, based on my palpation, the client reports no tenderness, pain, or unusual sensation. Let's check for temperature. Alright, the temperature is equal bilaterally in the surface of characteristic of the skin is subcutaneous tissue are free from lesion and muscles. I didn't palpated any muscles. Next is we need to palpate the posterior thorax for crepitus and fremitus. Same process. Okay, sir. Okay. Alright. Okay. 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 Based on my palpation, the fremitus is symmetric and easily identified in the upper region of the lungs. Okay? No signs of indication of consolidation or bronchial obstruction. No palpable crepitus, which is very much normal in our client. Next procedure is we need to assess the posterior thorax expansion, okay? In this procedure, we are going to place our hands in the posterior chest wall with our thumbs at the level of T9 or T10 and pressing together a small skin fold. And after that is we need to ask our client to take a deep breath, okay? And observe the movement of our thumbs, okay? Alright. Sir? Okay. Sir, I want you to breathe deeply. Inhale. Exhale. Okay, deep. Breathe deeply, sir. Okay. Okay. Another one. Okay. Alright. So, based on my assessment, when the clients take a deep breath, my thumbs move 5 to 10 centimeter apart symmetrically. No unequal chest expansion that occurs with severe atelectasis. No signs of pneumonia, chest trauma, or pneumothorax. Next is we are going to percuss for tone, and we need to start at the epicenter of the scapula and percuss across the top of both shoulder. Then percuss the intercostal spaces across and down and comparing the sides. And after that is we need to percuss the lateral aspect of the bases of the lungs. Okay? And comparing both sides. So let's start the percussion by following the sequence. Alright. Sir, I'm going to touch you. Is it okay?
Okay.
Alright. I'm going to percuss. Okay. Alright. Okay. Here. Okay. Here. We're here. Can you lean downward, sir, for me? The other side. Okay. Alright. So based on my percussion, the resonance in the percussion tone elicited over the normal lung tissue. Percussion elicit flat tones over the scapula. No signs or indications of hyperresonance elicited in cases of trapped air such as the emphysema or the pneumothorax. Next procedure is we need to percuss for diaphragmatic exertion. We are going to ask our client to exhale forcefully and hold the breath. Beginning at the scapular line T7, we are going to percuss the intercostal spaces of the right posterior chest wall. Percuss downward until this level allowed the clients to breathe. Next, ask the client to inhale deeply and hold it. Percuss the intercostal spaces from the mark downward until the resonance changes to dullness. Mark this level, allow the client to breathe. Measure the distance between the two marks. Okay, sir, I'm going to touch you. Is it okay?
Okay.
I want you, sir, to inhale and hold it for a while. Okay? Alright. Inhale. Okay, it's over here. Okay, exhale. I have here my pen. Okay. Alright. I want you, sir, to inhale again. Inhale and hold it for a while. Okay. Exhale. Alright, and we are going to measure it using this centimeter roller. Okay. Alright. So based on my percussion, my client diaphragmatic exertion is equal bilaterally and measured 7 centimeter. My client's diaphragm is higher on the right side because of the position of the liver. No signs of ascites and tumor.